What are some tests used to evaluate female infertility? A diagnosis of infertility is made when a couple is unable to conceive after 1 year of frequent unprotected sexual intercourse. In some cases, it might be a good idea to get evaluated sooner, such as in women over 35 years of age, in women that have a history of irregular menstrual periods, in women that have issues with the uterus, the fallopian tubes, endometriosis, PCOS, or something else, and in cases where there is suspected or diagnosed male factor infertility. Some common investigations for female infertility are a hysterosalpingogram. This is an X-ray to look at the shape of your uterine cavity and see if it's normal and to see if your fallopian tubes are open. In this, a thin catheter is inserted through your vagina into the uterus, and using this catheter, a liquid containing iodine or contrast is injected into your uterus. This contrast then fills up your uterus and the length of your fallopian tubes, and if your tubes are open, it spills out the openings of the fallopian tubes, and this can be visualized on X-ray. The second is a transvaginal ultrasound. In this, an ultrasound probe is inserted through your vagina to look for any abnormalities with your uterus or your ovaries, such as fibroids or ovarian cysts. The third is a sonohysterography. This is an ultrasound that's done after filling your uterus with a saline solution. It helps better detect endometrial polyps and fibroids. The next is ovarian reserve testing to look at the quality and quantity of your remaining eggs. This is especially recommended in women that are over 35 years of age, women that have a family history of early menopause, women that have had ovarian surgery, that have unexplained infertility, or have had a history of poor response to ovarian stimulation. Ovarian reserve testing involves a series of blood tests and imaging, such as levels of your follicle-stimulating hormone or FSH, estradiol, anti-Mullerian hormone or AMH levels, inhibin B levels, and ultrasound to determine your antral follicular count. Hormone level testing. This is to look for levels not only of your ovulatory hormones, but also the levels of your thyroid and pituitary hormones, which control many of the reproductive processes. Next is hysteroscopy. In this, a thin telescope-like lighted instrument is inserted through your cervix into the uterus to look for any polyps, fibroids, or scar tissue. And lastly, laparoscopy. This is not part of a routine infertility workup, but may be recommended based on the results of your other tests and your medical history. In this, a thin viewing device is inserted through an incision under your belly button into your pelvis to look for endometriosis, scar tissue, or any other issues with your fallopian tubes, your uterus, or your ovaries. In some cases, genetic testing might be recommended to look for any genetic abnormalities that might be contributing to your infertility. Depending on your age, your medical history, and the results of your physical exam, your doctor can recommend the relevant tests for your specific case.